In the most recent COVID situation report that was posted on the BC Centre for Disease Control, there's a graph showing an increasing number of cases where the source of exposure is unknown. I heard you mention Ottawa's lending some contact tracers to Fraser Health, but what more needs to be done to be sure that contact tracers can catch up? Because it looks like they're losing right now.
Yeah, I wouldn't say we're losing, but we're on the edge for sure. So we have reorganized. Last week we talked about how we have developed a coordinated workplace team and schools team and healthcare team to support all of the Lower Mainland. So that has helped quite a lot. Obviously, contact tracing is something where we need to spend time with people. We've automated some things, including the automated response. So people are now getting their test results, whether positive or negative, by text with information about what to do and how to start the process of determining who they had contact with, so that when they are contacted, that can speed it up. And there's an online form that we're putting in play for that as well. So there's a whole lot of things that we're doing to keep the edge on. We are still running around 20 to 25%, and that has been pretty consistent. Most of the cases still, particularly outside of Fraser, and Fraser's been the most challenging area because we've had such a rapid increase in a short period of time. But most of the cases are definitely linked, and ones that we find, we may not find them in time before they've passed on to the next generation, and that's where we're trying to catch up. But we are still very much committed to our contact tracing approach, and it is still within our grasp, although, as I've mentioned last week in particular, it was getting very, very close.
Do you have a follow-up, Justine?
Yes, I do. Thanks. Dr. Henry, you've emphasized personal responsibility here today, but I'm wondering if public health is being given all the resources that you've been asking for. Are you of the opinion?
Well, I think we're all wondering that. None of us knew what the second wave would look like. We committed very early on here in at what had happened, looking at what had happened around the world, that we made our plans for our healthcare surge, and that is holding true. We also committed to hiring 500 contact tracing support for public health in the summer and started that process, and it became clear that we needed more than that, so we've more than doubled that. It's always a challenge to get things in place in time. We have always been challenged with having a common IT system and our lab system. So as much as we ramped up as fast as we could, we had setbacks in that were not foreseeable, some of them. Things like a global shortage of the reagents for some of the laboratory equipment that we use made it challenging. There's so many things. So I don't think we're at the point where we can say we should have done one thing or another thing. We've tried a whole bunch of things. I will say that I was surprised at how soon in the fall we started to see the surge. And we were doing, as you can look at our numbers, we had gone up to 100 cases a day. We sort of gradually went up in September, but we were finding people. And then we had an explosive growth in the Lower Mainland. And now we're seeing that spreading around other parts of the province. So the orders I brought in last Thursday were trying to get ahead in all the other parts of our province, not behind like we were a bit in Fraser Health. So it's timing. We could not necessarily have predicted that, but we've seen the same things happen now in other places around the world. And we committed very early on to testing, tracing, isolation, and we're still barely managing to hold on to that. We've not abandoned that as some of our colleagues have had to do in other places in the country.
And I just say that, the Premier with the guidance and the recommendations of Dr. Henry and Steve Brown and myself, announced our plan for the fall. It was $1.6 billion is our incremental on top of the existing Health Ministry budget of $21 billion. The extraordinary investment this year, for example, in making up the ground on surgeries. We're adding 16% to our operating room capacity within the year, and that'll be more than 25% next year. And I think, but I think what's true is that we're learning all the time. When we presented here in March about acute care and acute care capacity, we based it on what we understood and what we saw in front of us, which was Italy and which was Korea and which was and was Wuhan and was other places. And now we know more about it. We're able to base it on our own evidence. So we put forward a detailed plan to prepare for acute care, to add contact tracing, to add seniors care capacity, to ensure that we could increase our capacity for testing over 20,000, a goal that we have reached. So a lot of those goals we've reached, but this is everywhere in the world an extraordinarily difficult challenge. But if there's more resources that need to be invested to support our strategy, we're going to find them, because this is that important to our well-being, to our economy, everything else that we address this public health emergency well. And that's why the Premier announced really in advance of others, 500 of them. Two things happened that were extraordinary. One, we saw a continuing need, so we've now more than doubled that. It'll be 1,200 by the end, which is significant. But the other thing that's extraordinary, I think, is the number of people who stepped up and wanted to do this work, who've come back or come back to healthcare, who are retired, who wanted to assist us in this work, and that's made it possible. So we're committed to those strategies and committed to providing all the resources required to achieve what we need to achieve. But all of that aside, COVID-19, everywhere in the world, the second wave is incredibly tough. And regardless of the question of resources, and on top of it, we need everyone to be all in. And I think we've seen in the last week, we've seen in terms of activity in the province, the decline in ferry traffic, for example, and other things, how committed people are. There's a lot of talk about when people step up or don't follow, or don't ask or don't step up and commit to this effort to bend the curve. But the reality is, overwhelmingly people are doing that. You see it in grocery stores, you see it in communities, you see it in activity all over the province, and I, for one, am grateful for that. But we absolutely need to keep going and keep expanding that effort.